In this video, we're going to talk about how to make the most out of your medical work experience. This is work experience that you do in preparation for your medical school applications. It's really vital to get good work experience and over a long period of time for a number of reasons. Most importantly, is to check whether it's actually the right job for you. Medicine is a vocation, and it'll take up a large portion of your life if you choose to go down that career pathway. As such, it's really important to understand what the job requires, what it entails, and therefore whether it's the right thing for you. Most people, when they start doing work experience, already have a good idea that they want to be a doctor. And therefore, what you really want to try and get out of it is trying to get experiences that can help with your personal statement and with your interview. Now, it doesn't really matter what sort of work experience you get, whether it's in a GP practice or family practice, or whether it's in a hospital, whether it's general medical specialties, whether it's surgical specialties, or it's any of the subspecialties like obstetrics and gynecology, anesthesiology, and so on. The key thing is to make sure you get some patient experience, and you get to see patients and you get to see the interaction between doctors and patients. Because one of the fundamental differences between medicine and studying things like biomedical sciences or physiology or anatomy at university is the focus on the patient. As such, getting as much time with patients in whatever environment, be it a clinic or on a clinical ward or in theatre or in a GP practice, it doesn't matter as long as you see that clinical interaction and therefore be able to start to glean some information about how doctors act and also, importantly, whether you can do the same job. One of the greatest resources in work experience is the doctors that you'll be surrounded by. It's really important to understand whether it's the right job for you. And so asking about what are the things that make them really happy in their job, but also just as importantly, what are the difficulties? And some doctors may talk about the fact that, especially when they're younger, they spend 5 or 6 years in university, whereas many of their friends not studying medicine only spend 3 years, so they start earning that much earlier. It's very difficult being in education for such a long period of time. Now, obviously, as time goes on, everything equalizes out. But certainly, when you're 21, 22, still in university with a few more years to go, and your friends are all joining the workforce, starting to earn money, starting to be able to go out and not have exams at the end of every year, it's very difficult. Now, obviously, it's for a short period of your time in your career, but it is important to understand. Also, in medicine, you're continuously learning. You've always got new exams, new things to learn, and lots of responsibilities outside of your day-to-day job. It really is a vocation. It's something that takes over a lot of your life. And so if you're not willing to do that, if you're not willing to give up a part of your life to be a doctor, it's something that you should reconsider or really think strongly about before applying to medical school. It's really helpful to talk to doctors about these things. And some of the things that you might preconceive as being difficult, for example, long hours, actually talking to a lot of doctors, it's not something that they're too worried about because it's part of the culture and it's what you know you've signed up for. And actually the things that you find a little bit more difficult are some of the emotional turmoils that you may go through. For example, being in a very stressful situation day after day can take its toll. And this is why, in addition to finding out what the joys and the hardships of being a doctor are, it's also worth asking the doctors what coping mechanisms they have. Now, this is doubly important. Of course, it's useful for you to find this out so that when you become a doctor, you can mimic some of those things if they're helpful to you. But also, in interviews, we do sometimes ask people, what are your extracurricular activities? What things do you do outside of academia? Now, the reason we ask these questions is for exactly this point, because often it's falling upon these hobbies and pastimes that help people to de-stress and to be able to have a life outside of their work, which is so important when doing a job such as being a doctor, where it can be very difficult. And if you take that home with you every single day and have no way to de-stress or decompress yourself by having those other hobbies, you can very quickly become overwhelmed by the job. So it's really important to talk to the doctors. And it can be any doctor, from the most junior person on the team all the way through to the consultants. And you will find that the older doctors tend to have much wider breadth of interests because they've started to develop them and understand the importance of them in order to be able to cope with the day-to-day rigmarole of being a doctor. It's also useful to talk to the older doctors because they may well be able to give you some more anecdotes of really amazing things that they've seen and done over the course of their career, and that can really be quite inspiring for medical students and also for junior doctors. So use the doctors as a resource and ask them specifically, what are the best things about being a doctor? What are the things that you find most challenging about being a doctor? And you may well find that we ask exactly the same questions in the interview, asking things like, what do you think is the thing that you'd enjoy most about being a doctor? And similarly, what do you think you'd find the hardest about being a doctor, given what you've seen in work experience? And if you haven't specifically thought about it, and if you haven't specifically asked the doctors, it can sometimes catch people by surprise when we ask these questions. And by having specific examples and drawing upon things like saying, for example, oh, I was talking to a consultant who said that they did X, Y, and Z, and it was one of the most amazing things that they'd done, and I found that really inspiring. It sounds so much more genuine and interesting for us as interviewers than someone just giving a generic answer, like amazing to be able to cure a patient. So do use your doctors in work experience as a resource. We're here to be asked those questions, and often we have long stories and lots of different anecdotes that we can draw upon that will both inspire you and also give you some grounding and reality of what it means to be a doctor. This is something that's really important and often missed by people who do work experience. A lot of young students come to do work experience and just expect to stand around and just watch things. But this is your opportunity to have a positive impact on patients, and also to see what the interaction between doctors and patients are. So think about your effect on patients. Some of the best interview and personal statement answers that we've seen are ones where people have talked about what their impact has been on doing their work experience. And it can be something as simple as having a patient in an elderly care ward who had no family and sitting down and chatting with them for half an hour at the end of the day, and them telling you all about their life story. Or sitting with a dementia patient or a confused patient who gets agitated if they're sat on their own. So you sat with them for a short period of time to give the nurse or the HCA a little break. Not only does that show compassion and an ability to really muck in and work as part of a team, but it also shows that you're an active member of the team and actively engaged in your work experience. So often when we have students coming into work experience, they sit at the side and they don't engage. And the problem with that is doctors, nurses, everyone is very busy. And so we do have a job to do as well. So sometimes if students are a little bit standoffish and don't really get involved with things and aren't actively trying to help, we're disinclined towards actually giving them the time and attention that they want and desire. So think about your effect on patients. Think about what positive contribution you can give to the team within work experience. Of course, you're not going to be able to make clinical decisions or be able to do practical procedures like taking bloods or putting lines in. But you can definitely sit and talk to patients. You can definitely do the verbal communication things of being able to allay fear if you see that a patient is scared. You can definitely do the simple things like filling up a patient's water jug. Not only will you find work experience more rewarding by being engaged, but also when it comes to your personal statement and when it comes to your interview, showing that you've been engaged, showing that you've actually interacted with people and not just stood as a fly on a wall for your work experience speaks volumes and makes us much more inclined towards believing that medicine is something that you're actually suited to and something that you actively want to do. Any person who comes into the medical field and sees the interaction between doctors and patients must appreciate the vulnerability of patients. It is really important when you do your work experience to think about that. Patients are vulnerable. They are often in a situation where they're scared, they're not well, they're not feeling 100%, and often sometimes getting horrible information or scary information that they're having to come into hospital, that they're going to need surgery, or that they're going to need additional treatments before they can get home, or in fact that there might not be a cure for what they've got, if it's a certain cancer which is spread, for example. In every situation, think about the vulnerability of patients. Not only is this important for you to be able to then consider how to respectfully be with the patient and observe the situation that you've got, but it's also really important when talking about patients in your interview and in the personal statement. By understanding that vulnerability, you can also talk about how you can help those patients in those vulnerable situations. For example, there was a fantastic interview that we had with an applicant, and they talked a little bit about the work experience that they had in a cancer clinic, and that one of the patients who was told for the first time that they had cancer had broken down crying. And then afterwards, when the patient left, the student had actually asked the doctor, "Do you mind if I step out?" Went and found that patient, sat with them for an additional half an hour and just had a chat. And at the end of it, the patient actually thanked that student. Not that they'd said anything or knew any of the medicine or the treatments that are potentially available, but simply that they'd sat and talked to the patient for that little bit longer, because it was a busy clinic. However much time that doctors and nurses try to give, sometimes all a patient needs is just someone there as a kind and friendly face. Those sorts of examples actually humanize you and also show that you've taken that step extra to really gain that understanding of the doctor-patient relationship. Now, of course, you need to do all of these things in liaison with the doctors and nurses in the clinics or the clinical environments that you're in. It's not always appropriate for you to be there with the patient, and especially not alone. In that particular example, they actually went in with the cancer specialist nurse, and they both sat together and talked to the patient. But it's important to be able to try and help people. And if you can show that you've got an engagement, an active engagement in your work experience placements, it shows that, again, you're not just a fly on the wall. You've actually taken something important out of it. But also, by considering the vulnerability of patients, you can also talk about these situations and these experiences with the reverence and the respect that the patient needs to have. They're not just experiences, but they're real people going through real things that you've had the privilege of sitting through. I cannot emphasize enough this point. In almost any personal statement and interview question, we are looking for examples of you being able to work as part of a team. Now, you have to ask yourself the question, why do we care so much about teamwork? Well, anyone who's done any amount of time in a hospital, a GP practice, in surgery, or elsewhere will know that as doctors and healthcare professionals, we always work as a team. It is very rare for us to work just purely on our own. We're always asking for advice. We're always referring to friends and to colleagues so that we can get the best treatment for our patients. So when you go to your work experience, always look for those examples of teamwork. And the fantastic answers that we get from both personal statements and from interview questions, where we ask about your teamwork abilities, the best ones, then preface it by saying, and actually, I understand how important teamwork is because in my work experience, I saw how closely the doctors worked with the nurses and the physiotherapists to get the patient standing and walking and getting them out of hospital, for example. Or I saw the great teamwork between the doctors and the pharmacists to make sure that the drugs that the patient was on weren't interacting and that we had the best combination for that particular patient. These are really important, and it's worth every time you see an example of good teamwork, and actually even bad teamwork where we haven't quite got it right as doctors, and jotting it down and then trying to use those as examples either in your personal statement or in your interview questions. And we'll go through a huge amount on how to use these examples and what sort of examples to look for in later videos. Now, this might sound a bit funny considering the diversity of medicine. What I mean by this is that medicine is not just a monolith. There are a huge number of subspecialties and different types of doctors around. And part of your job in doing your work experience should be to try and tease out what the different types of doctors are. The great thing about medicine is there is a different subspecialty that is tailored for every different type of personality. Whatever person you are, there is a niche of medicine that'll fit you perfectly. And part of what you need to do in your work experience is try to explore the different types of medicine, surgery, general practice that are out there. See what qualities there are for each different one, and then start to think about how that meshes with your personality. Again, we'll be producing a whole load of videos on the different medical specialties, what they involve, what sort of personalities are generally drawn towards them. But it's worth just having a look for yourself during your work experience. And if you're working in, for example, a general practice where you may not have exposure to other specialties as much, it's worth just sitting down and chatting to your GP or to the trainees that may be in the GP practice or to the practice nurses, because often they'll have experience of dealing with different specialities and finding out what the pros and cons of different specialities are and what sort of people go into them. When you come out of your work experience, you should have some appreciation of just how diverse medicine is as a job. There is literally a different subspecialty for every person. Try, if you can, to see if there are some that fit your personality, because it is so lovely to hear in an interview or in the personal statement where people have talked about their work experience and said, and actually this experience really gelled personality, and I loved how, for example, how detail orientated the intensive care ward round was and how they looked at every single aspect of the patient and tried to optimize it. Or, for example, you love how practical the surgeons were and how they worked with their hands, and it was really skillful the way that they kind of repaired the aorta, for example, in cardiac surgery. Or you loved how the anaesthetist was able to do all the practical procedures and get patients stable throughout what was a really tough surgery and making sure that the patient was comfortable at the end of it. Or you loved how the A&E doctor was able to see anything from a massive heart attack through to a broken bone and know how to deal with that. So you can see how different specialities, you need different skills and different abilities. And so if you can mesh that with your own personality and make that obvious in either the interview or the personal statement, it speaks volumes for how much you've taken out of your work experience. In addition to teamwork, two other areas that you must try and get some examples for, of both good and, if you can, bad, is communication and empathy. Communication is vital as a doctor, to be able to communicate not just with the patient, but with the rest of the team as well. So make sure you try and look out for examples of good communication. Again, one of the questions that we will ask either in the personal statement or in the interview, giving us examples of how you, as the applicant, are good at communicating. Why do we ask that? Well, it's because it's so key to being a doctor. So if you can bring in examples of where you've seen doctors and nurses or physios having good communication, and even if you've got examples of where they've potentially had bad communication. It's really useful because it shows that you've taken something out of your work experience. And similarly with empathy, like I said before, being a doctor is not just about learning the science. It's about being with patients and trying to empathize with them, trying to look after them as people and not just as conditions. So having some examples of where you've seen doctors and nurses showing empathy towards patients, trying to put themselves in the patient's shoes and trying to tailor their treatment and their communication and their support to that particular patient is vital. And if you can find that, it's really helpful to then reflect that in either the interview or in the personal statement, or both. Now, you may not be able to find any legal or ethical issues, but if you do find one, it's really helpful to jot it down. It can be something as simple as a patient saying, no, they don't want to have any blood tests taken. Well, they're absolutely within their rights to do that if they have capacity. But it puts the doctor in a difficult position because then they may not be able to tailor their treatment or find out whether the treatment is working properly for the patient. And sort of thinking about the dilemma between trying to convince a patient that they should have a blood test versus trying to find alternatives to blood tests is really important. In your interview, most medical schools will have some sort of ethical conundrum that they may give you to discuss and to try and work out what the best way forward is. So if you see any of those, it's really useful. But again, you may not, but if you don't, always ask the doctors. Ask them, have you had any sort of ethical conundrums, any clinical cases where it's had any ethical difficulties? Have you had any clinical cases where there have been legal difficulties? For example, if a patient has refused blood for a child and the child is below the age of 16, what are the legal issues with that? Now, both legal and ethical issues we'll cover in separate videos later, and we'll go through a large number of different scenarios, ones that are commonly come up in both interview questions, but also useful ones for you to consider just as you're going through your medical career as well. But if you find any, really worth jotting it down and reflecting on it, maybe talking to the doctors or the mentors that you're with, and then in the interview you'd be able to flesh that out and show that you've really got something out of your work experience. So there's a huge amount of stuff that you need to get out of your work experience. It's not as simple as just having a tick box of saying, yes, you've turned up to some work experience. Everyone who applies to medical school needs to have work experience. The way that you show yourself apart from every other person is by showing that you've got things out of it. You have to ask yourself at the end of your work experience, is this the right job for you? Is medicine right for you? You may find by the end of your work experience, actually, it's nothing like what you thought it would be and you didn't want to do it. And that's absolutely valid. And if that's the case, talk to people, try and arrange some more work experience if you're still not sure, and think and reflect on what it is that turned you off it. Because sometimes it might just be that one particular placement. And if you do another placement, you might fall in love with it. As I say, medicine is so vast and so diverse, there is often a niche for almost every person. When you come out of your work experience, make sure you have specific examples for each of the points that I went through previously. Try and jot down some of the things that you loved about work experience, the things that you thought, when I become a doctor, I can't wait to do X, Y, and Z. But also, try and jot down things that you didn't enjoy, because sometimes we do in the interview say, what were the things in your work experience that you didn't enjoy, or that you didn't quite realise that was part of being a doctor? And again, it can really blindside people if you haven't already thought about it. But it's a really important question to ask yourself when going back to that first thing of whether it's the right job for you. If you only ever focus on the positives, you may find later on that those negatives start to creep up on you. So if you really reflect on it at the time of your work experience, not only will it allow you to give really good answers at the interview and also when writing your personal statement, but it's also really useful for you to work out whether it is the right job for you or not. So like I say, there's going to be lots and lots of videos coming out where we'll tackle each of these specific points in a lot more detail and give you specific examples that we've heard in the past and try to give you a better idea of how to structure your work experience to get the most out of it. But you must think about all of these things when you're setting up your work experience, when you're doing your work experience, and at the end of your work experience.